Hello viewers, this is Dr. Sangeeta Datta, consultant psychiatrist, and today we shall discuss dissociative disorder. Dissociative disorder once upon a time was also known as hysteria, but nowadays we don't use that term anymore. Dissociation is a kind of mental mechanism or a mechanism of the mind where it is also called an immature defense mechanism, where a person without his own knowledge, because of certain things happening in his unconscious and subconscious, develops some behavioral issues. The behavioral issues may present as signs and symptoms of dissociative disorder. Signs and symptoms of dissociative disorder can be of different types. The commonest is jerky movements of the limbs, frothing from the mouth, and becoming unconscious. But such a person is not actually unconscious, he looks unconscious. All other parameters like his pulse, his blood pressure, his respiratory rate, or even investigative procedures like an MRI of the brain or an electroencephalogram of the brain would be normal in such a patient. Sometimes these kind of symptoms are often confused with that of seizure disorder, because in seizure also a person may show jerky movements, may show frothing from his mouth. However, for a trained clinician, it is very easy to differentiate between a dissociative disorder and a seizure disorder. And some investigative techniques like electroencephalogram of the brain would definitely suggest whether this is dissociation or this is a seizure disorder. Apart from these symptoms, sometimes there could be motor symptoms in dissociative disorder, which means that sometimes there could be maybe the foot or the hand or the lower limb or the upper limb. The patient might complain about different symptoms related to the limbs or the body. The patient may say that I feel tingling and numbness of my extremities, or I feel that one of my legs is paralyzed, I can't even move it. So these are called dissociative motor disorder. Apart from that, sometimes there can be dissociative amnesia, which means that a person sometimes forgets certain incidents in his life, or there could be a patchy memory loss, which means that the part of his life before that incident is remembered by the person, and the part of his life after the incident is also remembered by the person. However, he forgets one part of his life which is perhaps traumatic for him or disturbing for him, and therefore the mind conveniently forgets that part to maintain mental balance. This is called dissociative amnesia. Sometimes there can be a disorder called dissociative fugue, which means that a person wanders out of home or his office and just goes far away, walking all the way, or maybe he might take a vehicle also, and he doesn't know where he is going, what is his destination, etc. And sometimes this person is discovered by somebody else in some other place, and then the person does not remember the incidents that happened on the way. This is also because of severe mental stress, which is primarily happening at an unconscious and at a subconscious level. So we have mentioned that dissociative disorder is basically happening because of increased conflicts and anxiety in the unconscious or subconscious of the brain. To diagnose dissociative disorder, certain tests are very useful, especially ruling out some disorders of the brain or neurological problems is also necessary, because investigations can be done which will show or which will come out to be normal, which rules out neurological abnormalities, and we can do psychodiagnostic evaluation to actually find out what is happening in the unconscious or the subconscious of the human mind, to find out the factors which might have led to the dissociative disorder. Dissociative disorder is treated both with medications and through counseling and psychotherapy. Medications are primarily mood stabilizers and anxiolytics, and hypnotherapy may also play a very significant role in dissociative disorders. I want to mention something very specific here. Only people who do not have proper life skills or coping strategies dissociate in life. For people who have emotional resilience, they hardly dissociate. They actually face the challenges of life, and they can manage the challenges of life very well because they have excellent life skills and coping strategies. Therefore, it is very important for parents to instill proper life skills and coping strategies in children so that when they grow up and face the challenges of life, they don't have to dissociate. Dissociation is also a form of escaping from reality because the mind is not being able to handle reality. So when you see anybody having these symptoms that I have just now mentioned, you must take him or her to a psychiatrist. There is proper evaluation which needs to be done, and then treatment can be provided and a person can recover from dissociation. Of course, during therapy and during medications, it is also very necessary to strengthen the personality of these persons so that what seems to be a stress today ceases to be a stress tomorrow. Please remember to like or subscribe this video, and we promise to come back again with another interesting and useful topic. Till then, goodbye and take care.